Many women will tell me that they feel uncomfortable examining their breasts because they are so lumpy. Remember, you don't need to understand every lump, ridge, nodule, or bump that you feel in your breasts. What you are really looking for is change. And you will find that if you examine your breasts on a regular basis, that you will be very quick to determine if anything has changed. I'd like to demonstrate for you a self-breast examination in a standing position. I'm going to use this model. The examination techniques that we are going to discuss are identical whether you do them standing or lying down. When you do either exam, remember to keep your arm up over your head. The arm can be either over your head in a high position or in a low position with your hand behind your head. When you do the examination lying down, it may be helpful to place a small pillow or a rolled blanket or towel behind the shoulder of the breast you are examining. To begin the exam, I'd like to point out that we need to use the flat surface of our hands. Using the first 3 fingers, there's a soft fatty pad on this portion of the hand that is actually the most sensitive and the best examining surface that you have. It's also important to remember that when you examine the breast, to place the hand on the breast during examination parallel to the skin of the breast. A common mistake is to examine the breast in a perpendicular manner, and this it decreases the sensitivity of the exam significantly. When we start the examination, we start first by examining the area up over the collarbone, checking for lumps or anything that feels different. Then we move to the armpit area and check the armpit area for lumps or anything else that's new. We do these 2 areas first so that they are not forgotten during the examination. There are 3 different techniques that are used to do self-breast examination: vertical, horizontal, and circular patterns. They are all effective. It is important to choose the one that is most comfortable for you and to use the same technique every time you examine your breasts. For all 3 of these patterns, we want to move the examining hand in small circular motions during that pattern. Let's start with the vertical pattern. Start towards the armpit area, move the hand in a small circular motion down the breast, move towards the middle of the chest, and move back up again using the small circular motions, and repeat this until you have reached the middle of the chest. For the horizontal pattern, it's similar, but we start this time moving across the breast at the top, just underneath the collarbone, again using small circular motions until we reach the middle of the chest, drop down, and move back out towards the armpit area, and repeat this over and over until the entire breast has been examined. Include the bottom or underside of the breast during this technique, and also examine the upper portion of the abdomen. The circular pattern starts again at the armpit area, using small circular motions of the examining hand, go around the outer aspect of the breast, and then move in concentrically smaller circles until the nipple is reached. When the nipple is examined, squeeze lightly underneath the nipple, checking for discharge. In the horizontal and vertical techniques, since you don't end at the nipple, it's important to remember after you complete the breast examination to come back to the nipple and again check for discharge. What you are looking for during this examination is, again, change. That change could be a lump that wasn't there previously, a ridge, something that feels hard, areas of tenderness, any change in the nipple or discharge, or a lump in the armpit or above the collarbone. Anything that you feel that feels new or different needs to be reported to your physician. If you are not very concerned about the finding that you have discovered, perhaps it's just a slight thickening that you didn't think was there before, you can feel fairly secure in monitoring that area through 1 or 2 menstrual cycles. Oftentimes, fibrocystic change is what confuses the self-breast examination, and if you feel an area of firmness or hardness, that may disappear if you follow the breast through 1 or 2 menstrual cycles. When you complete the exam on one side of the body, of course, bring the arm on this side of the body down by the side, and bring the arm on the opposite breast up over the head again, and examine this breast with the opposite hand.